You say you never had a hiccup before. You may actually be telling a lie, or you never had one recently. Now, hiccup, we know, is common among babies. Yes, young babies. And what is exactly is the hiccup talking about? That involuntary, contraction of the diaphragm, something like that. That is the hiccup we're talking about. And so when it happens in children, it's not too much to worry about. There are some few hacks, like putting up on top of the tiny thread of a cloth on top of the child's frontal, and sometimes something like that on like a cut off of a cloth in the front of the face, and some other hacks that works. But in older adults, it rarely occurs, and when it occurs, it calls for concern, especially when it begins to occur repeatedly or it lingers. I've had one as an older adult, but not recently. And what was the cause? I trace it actually to stress, either eating in a hurry or, immediately after eating, going for a walk or trying to do a task. That is stress. It's a nervous problem. And then at other time, overeating. Then at another time, maybe spicy food. But I've not had one lately. But other common causes are these: spicy food, too much caffeine. These are stressors. Too much spice, too much carbonate, alcohol. Yes, we know. If you have been taking alcohol, you're at risk. If you're already having one or you have not had it, you are preparing yourself for eventual hiccup later, or maybe when you are older. And so these are some of the other and ugly side effects of alcohol, too much alcohol. And then there are other causes. There are some also maybe due to medications. Other stressors, spicy food, like I said earlier, could cause it. But there are also a few things that you could do. When we were growing up also, you could be asked to breathe from an earthen pot. It works. I don't know why. But I think since it has to do with the diaphragm, doing that deep breathing occasionally, breathing in and breathing out, could also give us a relief, because it's a form of exercise, and it's something I recommend that we do from time to time to help the waste to go out, and kind of exercising the respiratory tract and then the diaphragm. I think it will help, in addition to avoiding some of the causes, in order not to trigger a hiccup in an older adult. And when a hiccup lasts for too long, it's proper to go for medical investigation and find out the underlying cause of the hiccup. Besides that, remember, we believe that no disease is irreversible, but you must know the cause of it first. Very important. Find out the cause. At other times, we are told to drink water 7 times. Yes, we did all of that. And I think we can also try it, even as an adult, if you're experiencing hiccup. There are other remedies, like taking, apart from the deep breathing, and then you can also boil the mango leaves. Yes, mango leaves is great for things like hiccups, because it helps also with anxiety issues. It helps with nervous issues. And so we can boil the mango leaves and take moderately, and ensure that you're listening to your body, how your body is responding to it. Because you don't have to rush it if it's your first time, to see how your body is taking it. And then don't forget, moderation remains our rule.